Assalamualaikum and hello everyone. My name is Ahmad Hafiz bin Muhammad alias. My OUM ID is 8407190159270001. I'm a student of Bachelor in Management at OUM Kuala Selangor Learning Centre. For my subject, OUMH 2202, English for Workplace Communication for May 2021 semester. I will present about topic the effect of the COVID-19 pandemic on the hospitality industry and solution offered for our business. As a Royal Children Senior Manager, I will present the effect of COVID-19 pandemics and the solution for our business hotel. The COVID-19 outbreak has demonstrated an unprecedented situation before the Ferga tourism and hospitality industry. The highly contagious novel coronavirus continues to plague the sector and raises serious questions about the survival of the sector now and in the future. This addresses two important problems. First, related to the key challenges faced by the hotel and tourism industry in the current situation, and the second relates to important learning for the industry to survive. The tourism and hospitality industry is evolving based on the pattern of visit and the many efforts made by decision makers to attract visitors to support the sector and increase the multiplier effects of the industry. But due to the persistent conditions, travel restrictions were compiled with national and international travel bans, border closure, even cancellation, quarantine requirement, and fears of proliferation have posed extreme challenges to the tourism and hospitality sectors. Dealing with the COVID-19 pandemic, marketing strategy was a very important thing to do. To get optimal result, marketing strategy have a wide scope including strategies in dealing with competition, pricing strategies, product strategies, and service strategies. COVID-19 this give a sense of worry or discomfort to service company, especially Royal Children hotels involved in accommodation services. From a recent survey, almost 28% of hotels had cut manpower by more than half and over 51% reduced between 10% and 40% of headcount. Almost 45% of hotels are imposing pay cuts on their employees, while 60% are placing their employees on unpaid leaves. For short-term plan steps, what needs to do is, first, cost cutting. Decline in demand for hotel accommodation resulting in decline in RevPAR requires hotels to embark on cost-cutting measures. Managers must identify non-essential services and areas with significant declines in demand during these periods and mark them for cost-cutting in order to minimize or eliminate losses. This could be carried out by first shutting down unnecessary or redundant equipment in order to reduce utilities. This includes reducing the number of elevators and escalators in use, closing down some guest room floors and restaurants, as well as stopping the use of some expensive but underutilized facilities like washing machine. Another area to be targeted for cost cutting is a labor cost. Specific measures in this area include laying off some of the temporary employees, negotiating salary reduction, requesting employees to clear their outstanding leave and take no pay leave, as well as initiating no pay leave in advance. Additionally, due to the low occupancy rates being experienced by hotels, managers can train their staff to multitask because of reduced workload in all departments. In a typical hotel, labor costs and utilities account for approximately 50% and 10% respectively of total operational costs. Therefore, implementing this cost-cutting measure will help reduce costs and improve the bottom line. Other than that, collaborate with the Malaysian Minister of Health to make our hotel as a quarantine center. Make the hotel rooms to be used as quarantine centers for COVID patients to undergo self-quarantine process. This could indirectly to some extent generate income for the hotel by providing facilities for quarantine, as well as the hotel food management can provide food for patients who are quarantined in our hotel. We can collaborate with the Malaysian Minister of Health to make our hotel a quarantine center. Apart from that, application can be made to the Minister of Tourism, Arts and Culture Malaysia. Other than that, a new concept strategy for food business. Now, begin selling affordable packed food items outside the premise. Open a little stall in front of the building to sell economical breakfast to stay afloat. Introducing a drive-through for takeaways and engage the services of GrabFood and Foodpanda to deliver the public, so they can support us by ordering some or from our takeaway or delivery menu. This will certainly help us to survive during the tough period. Solution for the long term. Perception related to digitalization and the need to use online modes of interaction are also frequently observed. For example, emphasizing the need for the application of technology to create visual relationship to minimize physical contact between individuals. The use of artificial intelligence and robotics in industry is also recommended, which is in line with various scientific recommendations. The inclusion of robotics in various tourism and hospitality operation is expected to be common, where applications such as robotics in guidance, cleaning kitchens, airports, hotels, delivery can see increased consumption. For the conclusion is, in Malaysia, the COVID-19 outbreak has given enormous impact on the political system, the economy, social, health and national education. Even the impact also involves aspects of mental health. Following from outbreak, the Malaysian government has announced implementation of the Movement Control Order (MCO) to the people begin March 18, 2020. Thus, changing the pattern and the norm of our life. The implementation of MCO aims to creating social imprisonment in order to break the chain epidemic. I hope that the recommendation that I give can make the hotel competitive and able to survive the effect of the COVID-19. Thank you.